See you all. My name is Roberto Martinez. I serve as the Interim Health Equity Director within NMDOH. Susan Wilgers from the New Mexico Alliance of Health Councils is actually on vacation this week, and we're glad that she's taking that time off. Reason why I'm taking for like the introductions. So today, I think it's one of those trainings as we are conducting the community health assessment and improvement plan process. And we're going to focus around like data, not only about like where to get data or how to get data, but also interpreting data and the aspect of communications, right? Like how can we tell a story with the data, which is probably the hardest part. Showing a chart to a person, to a community member, to a health council member may not make much sense to them. How do we help them make sense of the data that they can receive from us? So this meeting is going to be led by the health equity epidemiologists, as well as by the Southeast region. So before we go into it, I like us to, if Christopher, and I see Christopher, I don't know if Annalise is here already, but if you guys can, and I see Rebecca nodding, so I think she's here. Christopher, would you like to introduce yourself to the group? I know that you have in the past, but please introduce yourself.
Absolutely. Thank you so much for asking me to conduct the training. I really am honored. So my name is Chris Whiteside. I work for the Department of Health under the Epidemiology and Response Division in a program called Community Health Systems Epidemiology Bureau. And we are in the newly formed Health Equity Epidemiology Unit. And I'm leading that unit along with Annalise Mayette, who is going to assist me today with the, I'll let her introduce herself since she just popped on.
Hi, I'm Annalise. I work with Chris.
Thank you, Annalise. And yes, so we're going to be conducting the training today. And again, thank you so much.
Yeah, and I was asking Christopher and Annalise to just take a chance to introduce themselves so that you know who the health promotion managers reach out in terms of when there is a data need, right? We have committed that to provide you with the data that you need for your assessments and improvement plans, as opposed to just digging yourself for the data, right? This training is going to show you a little bit about how to dig for some data. However, we maintain that like as you have data needs, going to the health equity epidemiologists through the health promotion managers makes the most sense, as they are the most acquainted with the data, right? And also, Christopher and Annalise, one of the things that they do is they speak to what in NMDOH we call the subject matters experts, SMEs. I love when they say the SMEs, but it's really a group of people who work in particular programs. And one of the things when you are presenting data or talking about data is that you really have to be familiar with the data source. Where is the data coming from? How is the data being collected? What does the data, when it's being collected, actually represents, right? So Christopher and Annalise, they have access to the subject matter experts, and they can ask them any questions that they may have in case they doubt the data or whatever. So it's important, that you know that as well, because there's a huge set of like protocols and norms that NMDOH uses to try to ensure that the data that is shared outside NMDOH, it's A, validated, B, has been approved, so that you can trust it, right? Like, and the public in general can trust it too as well. So I just wanted to mention that. And then, of course, I mean, Lori, if you'd like to say a few words or introduce your team too. I mean, Lori already from the Southeast Health Promotion Manager, but Lori, I'll pass it on just for an introduction, and then I'll say one more thing, and then I'll pass it on to you and Chris.
Okay, thank you, Roberta. Yes, I'm Lori Dudek, Southeast Region Health Promotion Program Manager, and I'm so excited to be here today. Chris Whiteside and Annalise are awesome, you all. I know on my end of it, we do not have an EPI in the Southeast region. And what they're going to be providing today is I like to call EPI 101. And so they really take away, the scary part of it, and they make it definitely applicable. So I know that the health councils that are on board right now, this is a wonderful opportunity for you to finally understand how IBIS works. Thank you, guys.
Thank you, Lori. Awesome. So, as just like Lori, and I see John in the audience. I see Diana, good, representing at least the central or the metro area. I don't see any of the other, at least, let me see just quickly here, my participants list. You know Amy, you also know Ophelia and Michelle Pacheco as well. So just like Lori, like if you have any data needs in your regions, you can talk to her, and then Lori can also help coordinate with Annalise and Christopher as we are, trying to get the data to your hands. So just a couple of key things then that I want you to take away from this session. One is making sure that you know the faces. Chris and Annalise, that's probably your biggest takeaway this session today, is like knowing that they're a group of people, a couple of people, and behind them there's another group of people in NM-IBIS that you have accurate data, and that you can reach out to them. They're accessible, they're awesome. I'm pretty impressed with them, and that you can do that through Lori, right, or any of the health promotion managers or your health promotion specialists in your teams. So that's one takeaway. The second takeaway is, as we think about data, my one recommendation is start with stories, right? Data and charts are, or can be, like, to many people, may not express the full picture. It may not be easy to understand. However, stories from our community members, from your stories, from your health councils, that can help make sense of data is really the best approach, potentially, as we communicate the different scenarios that our communities live. And I leave you with this quote from John Lewis, who said that the last horizon in the conquest for human dignity is conquering the human heart. And he said this under this context. When we are, for example, thinking about fighting homelessness, right? We need to be able to not only share data, but also we need to be able to humanize the issues that we're talking about. What that means is that, for example, if we were to sit down with someone who has experienced homelessness, and at the park, at the bench in the park where they live, then when we hear that there are 3,500 people in New Mexico that are homeless, then we are not going to think about that number the same way as if we did not know a person who is actually experiencing homelessness. So as we share data, as we share stories, we have this need of humanizing the stories that we are looking into the data, and helping leaders in your communities, helping your partners to understand that human part of the story, right? So I just invite you to also, as we think about data and share the story, humanize it so that we can touch the hearts of people who make decisions, right? And that they can see data in a different way. Without that, with that, I'm just gonna pass it on to Chris and Lori, who are going to guide this training. And thank you so much for being part today of the training.
Thank you so much, Roberto. I really appreciate that quote. As epidemiologists, we have to keep that in the forefront of our minds, because sometimes we look at numbers and they seem like they're just numbers, but these actually represent people going through issues. So let me start my slide. Just 1 second. Okay, can everybody see that? Give me a thumbs up if you can. or you
Yeah,
might
we
have
can
to
see
say
it.
something. Oh,
Yes.
thank you so much. All right. Yeah, thank you, Roberto, and thank you everyone for having us here to conduct the training. So just a little bit of a disclaimer before we get into the meat of it is that we're going to share a lot of information today, and we understand that it's a lot, and we don't expect you all to be data experts by the end of this training, and be able to just run and do your own analyses. But this is just a really good overview, like Roberto had mentioned, and hopefully you'll come out of here at least with the ability to know where to start and where to go and how to interpret data. But everything that we present here today, the Department of Health, all the resources that we have, we will make available. And I've been assured that the Center for Health Innovation and NM-IBIS will make available to you any of the resources that I share from them. So while I get started, I just want to say thanks again to the Center for Health Innovation and NM-IBIS for developing this training. Many of the slides presented here were developed by them, and we have Emily on the line today, who can jump in at any moment and with questions or to clarify anything. And also, if you do have questions, feel free to put them in the chat. Annalise is going to stop me and we can answer the questions as they come in. All right, so this is what our objectives are today. We want you to be able to follow a step-by-step process to move from identifying a potential priority health indicator to finding equity and disparity data about that health indicator as it relates to social determinants of health. We want you to be able to connect yourselves to the data by navigating key data sites. And as was mentioned, we're going to focus on IBIS today, though we will be looking at other sites as well, and how to reach out to NMDOH for data support. We're going to focus a lot on looking at the community health assessments to identify priority health indicators on IBIS, and on IBIS, how to navigate the query system to find county, neighborhood, and demographic level data on health indicators. All right, so this is our agenda. We want to talk just very briefly because I know you all are familiar with the CHIP process, but we want you to know how data fits into that process. We're going to look at the finding data flow charts provided by NM-IBIS and give you an idea of how to use those. Then we're going to look at certain key data sources that we want to emphasize: the IBIS community reports, the query system, getting data support. Since this is a 2-hour training, we're going to give a 10-minute break approximately halfway through. And we're going to then go break into an interactive activity that we will give you instructions on when that comes, and Annalise will lead us out in that, and then we will close with our data interpretation basics, and then Q&A, any questions you might have. So this is something you've probably seen before, but this is the state health improvement process. This is a graph that we've been using, or an illustration we've been using for quite a while, to kind of show you how everything is going to come together in the development of the state health improvement plan. As you can see, circled above there at the top are the community health assessments, which we're going to be using them to, as you will be using them to set your priorities and your community health improvement plan. That's going to feed back into the data and reporting unit, which we're going to use your community health assessments and our data, and then that's going to feed back into the process of compiling all the data, and then people are going to use that to prioritize. So this is a very integral part of the process, and we're so glad that you are all here to play a part or play a role in that. So this is just specifically the community health improvement plan process, and just to give you all some context, you're probably at the point where you are looking at the assess section, which is community health assessments, other data collection, data analysis, before you get into your health priorities, which will then feed into your goal, strategy, action plans, and help you to address the priorities. And then your outcome is that you're going to develop some type of process measures, and then something's going to change and hopefully will have an impact on health outcomes. This is what we're all here for, improving health outcomes in the end. And so now that's all I have for the CHIP and this community health assessments. We're going to focus on certain data attributes today. And this is a brief overview before we get into the meat of it. When selecting a data source, excuse me, I can't see here. There we go. When selecting a data source, consider, these are some things we want you to consider. Population-based, and we're going to give the definition of that, and or client patient data. For the most part, the Department of Health, we deal with population-based data, but we do have some data that are record level data that you can access. And population just means everyone in the community has an opportunity to either be selected as a case, or they're somewhere in the denominator. Population sample data, as I said, includes only a specific portion of the population that's representative of the whole. We'll get more into this, so don't worry. Person versus event, record level versus aggregated data, and then quantitative and qualitative. Quantitative and qualitative research or data. Quantitative is our objective. It deals with facts, not a person's subjective feelings, which was qualitative, which gives insight to a person's viewpoints. Quantitative, it's usually presented with numbers, rates, statistics that can be counted. Qualitative data are usually brought into an overall theme or a narrative where we can kind of explain how people feel. Quantitative tells us what's going on, how many or how much, how often. We look at trends and patterns, or qualitative data helps us understand the why, how, or what influences behaviors or issues. Quantitative data, we do surveys, experimental research like clinical things, and qualitative includes interviews, focus groups, observation, case studies. Quantitative findings can usually be generalized or applied to the larger population, like we'll see with some of the data sources that I'll show you later on. Qualitative don't usually apply to the larger population. Usually it just applies to that segment or group of people that you've interviewed or surveyed. All right, so I did mention we were going to look at this, how to find data using the finding data decision tree. So this helps you to follow a logical path to asking questions, to finding data to support your investigation. And NMCDC was nice enough to link the key data sources that you would use. And there's also a separate path for health councils. So let's take a look at the finding data decision tree, and we'll go through it. And I'm not really sure how to share this, but I will figure it out. Okay. All right, I think everybody can see that.
Yep.
So, all right, thank you. So we're going to focus on the county health councils to begin with. And as I said, there's a separate data decision tree for tribal. But in the beginning, you have to ask your question, does this, as you begin, you want to acquire data for the most part to decide on a health priority, or decide on what are the most pressing issues in your county or your community or your region. And do you have something in mind already? Oftentimes, because of qualitative data, we already know that a lot of people are concerned about a certain issue. Let's just say, for example, alcohol abuse. And the next question you would ask is, has your health council already identified a potential topic? And then if you say yes, if you say no, you can go here and you can go back to some of the community reports, the data dashboard, the HSD data book. As I mentioned, we will make these all available. There are tools on NM-IBIS that we're going to look at. And then the question that you're going to ask, is this a root cause? So let's see if I can make this just a little bit bigger. So a root cause is a structural or societal issue, phenomena, or barrier that ultimately causes individuals in the community to suffer from the adverse health indicator. So root causes are often embedded in historical, political, social, cultural contexts, and often involve societal, institutional racism and discrimination. And this is what we're looking at here at the bottom. And now at this point, you know, when you're making that decision, that would be, I would consider that, you know, qualitative. But there are some data that can associate these things with your health indicator. And that's, you know, heterosexism, classism, racism, poverty, ableism, sexism, structural and institutional barriers, distribution of resources, ageism, religious prejudice, and xenophobia. So yeah, that would be a good question to find out. And once you find that out, is it a social determinant of health? And so we'll look at a few social determinants of health on the next slide. But there are some resources here. And I just want to reiterate that all these resources we will make available if you don't have them already. The County Health Equity Data Dashboard, which is something that NMCDC is working on with the NMDOH. And the NMCDC Data Collaborative, the HSD Data Book, which is something that HSD, DOH, and NMCDC are working on together. And there's so many other data sources that we'll show you in just a bit. And if it is a health indicator, we already know that we can find supportive data from NM-IBIS, and all these data sources are on NM-IBIS, and we'll talk about some of them. We have the COVID data dashboard on NMDOH, which does break things down regionally and by other demographics. There's county-specific COVID data dashboard, and some NMCDC maps that, you know, talk about COVID vaccine, just as a few examples. Now this, once you've looked at the social determinants of health, you can go back and look at the health indicator analysis to conduct a backwards root cause analysis, because root causes and social determinants of health are very closely aligned. And why? So in other words, why do you want to improve the social determinant of health? Once you've done all that, you can go back here and decide, does the community, you know, want to pursue this topic? And that's where you're in there, as I showed in the illustration before, you're going to decide, while you're setting your priorities, you're going to decide, does the community want to assess this as a priority? If they say yes, then you're done, and that is one of the priorities you're going to focus on. And you know, once you get that, you're going to want to look at specific data for that topic, in addition to the data that you have already. You want to document everything that you've done, because someone might, you know, ask the question, well, what data do you have to support why you've chosen this specific priority? And these are just some of the questions you can ask, and you may want to include and record so that you can show that if anyone asks. All right. So I think you guys are seeing the presentation again.
Yes, we're back in the.
Oh, great. Okay. So I mentioned social determinants of health. Now there are many, but I decided just to highlight these specific ones that are highlighted on the Healthy People 2030 website. Education, these are issues that are closely associated with root causes that impact the health indicators that we're looking at or that you might be interested in. Education, access, and quality, which is some of these are obvious issues that we have to deal with. Economic stability, social and community contexts, the neighborhood and built environment, healthcare access and quality. So now, while these are social determinants of health, they're also, a lot of these things are indicators that can be health indicators. So for example, we at the Department of Health focus a lot on healthcare access and quality as an outcome that we want to improve, because we know that that will then improve other health outcomes. All right, as I mentioned, there is a separate map for tribal health councils, and the difference is that tribal leadership involvement needs to be there throughout the entire process. And we need data resolutions, agreements, or memorandums to protect data sovereignty. Data should be sub-county at least, tribal specific geography at best. Data sources may not be public or easily accessible. Many data sources will require that you contact an agency, and we will talk a little bit about who you may contact at the Mexico Department of Health. And we do have you may want to use a tribal liaison for this. So let's take a look, excuse me, at the tribal health councils root cause analysis or map, I should say. Okay, there we go.
Hey, Chris, while you're doing that,
Yes.
Roberto had a question, I think.
That's yeah, if Roberto wants to go ahead and say that's fine, or you can.
Well, I was wondering,
Okay.
Chris, when you were speaking about the social determinants of health, and I don't know if you can go back to that slide.
Yes, I can.
But I was wondering if there would be any brave soul here in the audience who would like to make a connection on how social determinants of health affect the health of individuals. And I can start, I can provide like one example and then see if there's a brave soul as I give my example. So for example, in Cleveland, where I was doing some work during the past couple of years too, there was a study about like a particular zip code a zip code that had like a high degree of social vulnerability. So a lot of people in low socioeconomic status, but also the housing, and there was actually a housing project there, like run by the housing authority, the federal housing authority, and also there were some other what they call the low-income housing, not run by the federal housing authority. So one of those housing projects not run by the federal housing authority actually was having quite a bit of mold in the property. It was a building, it was a larger building, and the doctors in the nearby hospital actually identified that most of their asthma exacerbations, most of their asthma hospitalizations, people who suffer of like a reactive airway disease, meaning, for example, dust can trigger an asthma crisis, which is it's difficult to breathe, right? So most of the people that were going to the emergency room due to like difficulty breathing because of asthma were actually located in that zip code. And then they further investigated and they realized, well, actually a lot of the people that are coming to the emergency room, a great percentage are also coming from these buildings in the community. So this built environment, the mold in that building had an impact in the asthma crisis, that had nothing to do with it had nothing to do with just necessarily the physical health, like the physical response from the individual, right? In the sense of like, if they were living in a different environment, probably they would not have those asthma crises, right? So I think that's an example of how those type of built environments impact our health. But I wanted to know if there would be one other brave soul that has heard, another story as to how access to healthcare or education or economic stability impacts our actual health. I don't know. Any brave soul? We can give 10 seconds. If not, we can keep going. But I just want to make sure that we allow people to also share their experiences.
Well, Roberto, you know me, I'm always brave. But I will actually share the article link. I will find it for everyone. So Forbes magazine actually came out with an article, interesting enough, earlier this year, talking about genetic code versus a zip code and the social determinants of health. And I found the article fascinating. So I do encourage, I'll put the link in there, but I want us all to think about it. Where do people live and is their health affected? I recently used zip code data. Well, I say recently, but it was like 10 years ago when I was working in healthcare. We use zip code data and diagnosis related code data to work with Doñana County Health and Human Services on where to partner to implement a healthy living diabetes wellness program called Nuestra Vida, which is called Our Lives. So anyway, just some thought, but I'll find that Forbes article link for y'all. And thanks, Chris.
Thank you, John and Roberto. That really does add a lot of context to why we're interested in looking at social determinants of health. So it's very much appreciated. And social determinants of health are one of the most important areas of health equity because we were talking about root cause analysis and social determinants of health. And sometimes, at least at the Department of Health, we have a tendency not to focus on some of the ones that we can't have an impact on. But with the State Health Improvement Plan, there are other agencies involved that can and do have an impact on some of these other social determinants of health, such as economic stability, social and community context. So thank you for that context there. So I was just getting ready to move into talking about tribal health councils and their finding data decision tree. And as I mentioned the last time, we have so many resources and we're going to make everything available. So if I go over this fairly quickly, please know that we will provide, or NMCDC and the Department of Health will provide everything that we show here. So does the Health Council wish to conduct a community health assessment? First, some of the reasons why we already know, to assess tribal health overall, look at select priorities for the community health assessment, I think is where we would go right here. The first thing you need to do is present it to the tribal council leadership. And if you get approval, if you don't get approval, that ends it. But if you do, then it's time to engage and ensure that the tribal leadership is a part of the entire CHIP process, which I'm sure if we have any tribal health councils here today that you have done that. So the next step would be to complete resolutions and agreements in the memorandum. And then this is where things get a little interesting. Does the community have a priority in mind already? If so, you can go ahead and move on to the root cause like we just looked at, or identify your health indicator. So gaining access to a lot of this data. We're going to go over just a little bit in the next couple of slides. But after that, and Emily can correct me if I'm wrong, the process would be very similar to the county health council's finding data decision tree. You move on to the health indicator, as we mentioned before, the root cause analysis, social determinants of health, and then you would collect the same data that you would to present the findings to the community and to set your priorities, and then finish your community health assessment so that you can develop your community health improvement plan. All right, so I did mention that, and I've recently found out that not everyone is aware of what the Department of Health does collect as far as tribal health data. We do, as was already mentioned, I think, have some data on infectious disease, of course. Most people are familiar with what we have with COVID-19. And there are some access that we can provide for tribal health leaders and NM-IBIS. The behavioral risk factor surveillance system, which I'll look at a little bit later, does include, it is an annual survey run by the CDC, but the CDC does allow us to ask state-specific questions. And so since we have so many tribal entities within our state, we do ask about tribal affiliations. So we do have tribal specific data on the BRFSS, which is a very good tool. Of course, we do have some data at Vital Records, Indian Health Services, as we were talking about earlier. And I think one of the reasons that a lot of people don't know this data is available is because no one gets the tribal data without explicit consent. Tribal health leaders must give consent. Did someone have a question? Oh, okay. So the way that we've done it in the past at the New Mexico Department of Health and accessing tribal health data is to contact directly our tribal health epidemiologist, which is we have a lot of vacancies right now in NMDOH. That's one of our vacant positions. However, and if you speak with your with your health promotion specialist or reach out directly to Annalise and I, we can put you in contact with the right person to request tribal data. All right. So I just want to take a second while we're still talking about tribal data to take a look at this nice queryable website where you can where anyone can access certain data points on tribal health. So I'm going to show this to you all. All right, so okay, so this is from the census, United States Census, and you can look at specific data points. And I'll go ahead and select New Mexico. And once you select New Mexico, you have the option of all these tribal areas that you can select. I'll go ahead and select Jemez Pueblo, since that's not too far. And so this, even though I don't know why it's not showing up too well on my screen, but I hope you all can see it. But this does give basic demographics, such as age, race, Hispanic or like ethnicity, place of birth, ancestry. And you can also get information on employment status, commuting to work, occupation, industry, housing, which is very important data point that they collect on the from the census and the ACS. Housing occupancy, housing tenure, mortgage status, gross rent, computer and internet usage, which is of great interest in some of the more rural areas, economy, income and benefits, health insurance coverage, which is also of great interest. And percentage of families and people whose income in the past 12 months was below the poverty level. And of course, education, educational attainment. And there we go. So a lot of these indicators or areas or categories are closely aligned with social determinants of health as well. So this is a pretty good tool as the first one that I'd like to show you all. All right, so this slide is just, again, underscoring that, tribal health councils do have access to certain data. And you might want to look at the following resources: medical or clinical data. And we already talked about IHS, and there's also the resource and patient management system. There are some record level data that you may be able to access. And again, our tribal health EPI or someone at the Department of Health can help you navigate those county or state health department files, certain disease registries, and we talked about NM-IBIS, legal and social service data from outside of DOH. We can help you access that as well. We just looked at the census query on my tribal area. But there are so many resources, and I would say when it comes to gaining access, it just might take a little bit more time than some of the things that we're showing here. Looks like we have a question. Sarah? Sorry if I didn't see your hand earlier.
No, thank you so much. And I'm so sorry for this might be an ignorant question, but you were talking about the Healthy People Project, right? And collection of data through for that project. Am I right about this? But then when you went to show us the data, it seemed that it was from the American Community Survey. So I'm a little bit confused, of the connection and how they overlap.
Okay, no, that's a good question. So Healthy People 2030 is not really a data source. However, you can go there to find data points. Healthy People 2030 it's really a goal for the country, for us to reach a certain level of health. They're looking at specific health outcomes, and all the health outcomes on Healthy People 2030 come from different data sources. And so one of those data sources that we were looking at in my trial would come from the census level data, or census, and the American Community Survey. So when we looked at that, we were just looking at specific data points from the census and the American Community Survey, which will feed into the Healthy People 2030 website. If you ever go there, if you look at some of the goals, they will tell you the data source, and they'll tell you what the goal is to reach by 2030. I hope that answers your question.
Yeah, so you're basically telling us, showing us how to work through the American Community Survey, right?
Yes, so my tribal area, this one specifically is the American Community Survey, and there is another website if you want to look at other geographical areas that aren't tribal areas, and we can I'm not going to touch on that today, but we can definitely make that available to you, Annalisa or I, or someone else, if you're interested in perusing that website. It's just as easy to query as my tribal area, and it has a lot more data that you can look at and download.
So Chris, my understanding was that the tribal data is part of the ACS. So it's you're saying that it's not, it has to be eventually, let's say if you're looking at some research questions, specifically to NM, we have to merge the data from different parts with the tribal data. Am I correct about this?
So I think and Annalise can correct me if I'm wrong, but if you were to go on the regular American Community Survey, everyone who is a part of a tribal area would be included. You just wouldn't be able to look at the data by tribe. So you would have, you know, whatever information you're looking at. If you were looking at, for example, demographics, you know, it would list tribal members as, you know, whatever race they selected. You wouldn't be able to look at it by tribe. I don't know if that makes sense. You know, whatever
Yes.
geographical area the tribe overlaps, that's what it would say if you were to go to the other queryable site that I was mentioning that I'm not going to go into too much detail on.
Yes, thank you. So
Okay.
you're saying that like if you're going to extract like a report for a specific tribe, this is like the website you go to.
This is where you go. Yeah.
What if like you were just doing an analysis using like zip codes, then the ASCS is like the go to it.
Absolutely. Yeah. And
Thank
it
you.
wouldn't exclude anyone, you know, that is in a tribal area. It would just include in whatever the geographic area you're looking at. Okay. So we talked a lot about tribal health or tribal accessing tribal data. We're going to look a little bit now at county data's health sources for indicators. So we mentioned the NM-IBIS, which we can query with various data sets on by county. We have, of course, I mentioned the COVID data dashboard. We have the county COVID data dashboard from the NMCDC website, and the zip code tabulation area level COVID vaccine maps on the NMCDC website. Excuse me. So I just want to take a brief moment. I know I tend to kind of not notice questions, but I think I did notice that there were a few questions. Are there any other questions before we move on to the next section? Okay, no questions in the chat. I can't see the chat, but I'm assuming there's none.
I don't see any questions in the chat. Thanks, Chris.
Oh, thanks, Annalise. Okay. All right, so I want to just give we're going to go into so much more detail in NM-IBIS, and you know, there's so much on here. I thought I would just, like I mentioned before, kind of give you an overview of some of the things that NM-IBIS has, and like I said, we're going to go into more detail later. And this is the front-facing website for the New Mexico's Health Indicator Data and Statistics website called NM-IBIS. There are many tools on here that will get you to where you want to go. We've made community health data so easy you can do it within 2 clicks, and we'll show you that later. But I wanted to show you specifically how you can query a data set by county or region. So I mentioned this earlier. If you click on query data sets, you have it by vital records data, morbidity data, and we'll talk a little bit about what morbidity means. Health survey data, demographics, environments, special secure queries that you would need to gain to get approval before you go to those. But I want to look specifically at the behavioral risk factor surveillance system, and I might be a little bit biased about this survey because I was the EPI over the data steward in EPI over this survey for almost 5 years. But as I mentioned earlier, it's a the survey is done in conjunction with the CDC, in collaboration with the CDC, on preventive health practices and risk behaviors, you know, such as chronic disease and preventable infectious diseases. And the survey is done by using a telephone method where we just cold call people and ask them about their health. Now you might be wondering, well, you know, if we don't survey everyone within your region, how do we know, you know, what's really going on? So these data are what we call weighted data to be representative of the entire area or region that we're looking at. So I thought we could look specifically at a county for a chronic disease or condition. If you're interested in, let's see if I can find diabetes, doctor diagnosed diabetes, then you can come here and customize your query. That way you can look specifically at county, and they give you the choice between accrued prevalence and age adjusted. And we'll talk about the difference between those a little bit later. But if I were to select doctor diagnosed diabetes, and then it gives you the option to select a specific year. You can look at 1 year, or you can combine years of data. If you're interested in looking at a geographic area, then you have this option of selecting a specific county or health region. Since I'm going to be working with the Southwest region, I'll go ahead and select Southwest. You have the option of looking at doctor diagnosed diabetes among all ages, or we can just say specifically, we can select from these groupings, or we can enter a custom age here, just as long as they don't overlap if it doesn't fit within those age groups. And we can select sex if we want, or some other demographic characteristics such as race, ethnicity, marital status, sexual orientation, education, employment status, health insurance coverage, and income. If we want to do what we call a cross tabulation to see, among certain income levels, what is going on with diabetes. So I'll go ahead and select income. And then I can select how I want to display. I would like to look at it by geography and group it by income. So let's see what we get. Okay, so what we see here is it'll give us for the Southwest region the percentage of adults, because I might have failed to mention that the BFSS is asked only of adults. The percentage in the Southwest region that have been diagnosed with diabetes by a doctor, and combining the years, these 3 years. So this gives us a pretty good idea of what the prevalence of diabetes is in the Southwest region. But we're also looking at it by income. So we can see here that from the lowest income of 0 to 14,000 or $15,000, 18.3% of those adults have been diagnosed with diabetes. But we see this as we look at it, we see that it does go down by income. So with adults living in households making $75,000 or more, 9.2% in the Southwest region have ever been diagnosed with diabetes. And then at the bottom, it does give you a little bit of information on how to interpret the data. This comes in really handy if you wanted to somehow, if you wanted to present this to someone in your region and you wanted to be sure about how to describe these data, this is where you would go. This will describe the confidence intervals, which we'll talk about later. And the data source, issues with the data. And I think, yeah, some right here it explains that these percentage report have been produced by weighted samples, so that they represent the entire population in your region. So we can say with somewhat a certain percentage of confidence, or with certainty, that 18.3% of adults in this income category have been diagnosed with diabetes in the Southwest region. Okay, so yeah, that's just a brief overview, and I mentioned before, we're going to dive a lot deeper into IBIS, but wanted to show you that. And we're going to give you some time to do and peruse IBIS on your own, and along with us helping to guide you during this training. All right, this is another resource that I wanted to point out. This is not developed by the Department of Health, but it is really good to be able to look at and compare counties, you know, by certain health indicators. So what this does is, let me see if I can pull this up. This website called County Health Rankings will allow you to look at your specific county and compare your county to other counties to see how your county, how healthy your community is. So I'm going to just look up my county, which is Sandoval. And this website, it's just so much that it produces for you. According to this, my county is among the healthiest with health outcomes, health factors. It'll also bring up county demographics. I'll give you a snapshot, and a lot of these data that we're looking at right here are from the BRFSS and other CDC related data and federal data that's made available where they ask about county health behaviors, you know, and also clinical care, social and economic factors, physical environment. And then there are other resources that are here, which I think, you know, if you're interested, you can, you know, avail yourself to, because they not only go into more detail about social determinants of health and how that impacts health within your county, but it also will give you a greater understanding of where these health outcomes are, where they're getting these health outcomes and indicators, and how to really interpret the data. But this website does a really good job. And you can download data sets that you can use to create your own maps and do certain things if you'd like to. And I forgot to mention, on NM-IBIS, you can download your query as well. Just go back there really quickly and show you that. If you click export to Excel, it will export it so that you can save it somewhere, you know, to use for a future date, and you can save your data wherever you'd like. All right. Okay. So this is another, I'm not sure a lot of people know about this, but this is an NM-DOH's website where you can access reports. Many of our reports have county level data and regional data that you can access, and just download the report so that you can save. And a lot of reports that we produce in NM-DOH are annual reports that that a lot of the reports do have trends in it, but every year you can expect, or over every couple of years, a similar report. So let me show you really quickly.
Hey, Chris, while you're looking for that, I just want to let you know we're running just a little bit long compared to our, schedule. So it is 2 o'clock right now.
Okay, thank you. I really appreciate that. Yeah, we want to make sure y'all have enough time to peruse all this that we're showing. But let's say you went to, this is nmhealth.org, and you went here and you were interested in data. I would go and select researcher, but all these other areas are available to you to get information on as well. If you select researcher, it'll take you to the epidemiology and response division's website. And then there's several reports that you could access that will not only give you county level data, but will explain, you know, and give an explanation is exactly what's going on. But like I said earlier, we'll make that available to you as well. And all these reports can be found on that website, except for the county health rankings, which we just looked at. But we do have the BRFS annual report, the YRS, which is youth risk, birth control, substance use, state of mental health, DWI reports, traffic crashes, HIV, STIs, other infectious diseases can also be found there. All right, so I won't go over this slide because Annalise is going to give a little bit of instructions right before, but this is going to talk a little bit about how to access those community reports and select your county, and the NM-CDC. We're going to talk about that just now so you can see how that works. And of course, we talked about the American Community Survey. We'll make that available to you as well. So this, I think I have permission from Emily to skip over this slide, but this is just an introduction of the type of data you can get from NM-CDC. This is just really an introduction to that. So I'll go ahead and we'll look at this slide, which is going to talk a little bit about alcohol outlets in Las Cruces and show you how you can access data specifically for your county from NM-CDC's website and the CHI. And let me know if you can't hear it.
Cannot hear it.
Okay. Okay, give me a second to see if I can figure it out. If not, then we'll skip over the videos for sake of time and make them available. Okay, let's see.
CDC website.
Can
We
y'all
will
hear it
cover
now?
how to get to specific maps, and we'll cover the legends and layers that are included in these maps.
The map portal can be accessed by the website nmcdcmaps.org. There are 2 access points to the maps via the front page. We will be focusing only on gallery for the first half of this tutorial. Once you are on the gallery page, we can then access a variety of different maps. There are many data map sets for a variety of different health-related topics. In this example, we will be utilizing the alcohol outlets, DWI crashes, and related indicators located here. If you hover over the picture, it will say Open in Map Viewer. Here we have the actual map. You will notice patches of color information and dots of varying colors. To the left, we will see a sidebar with the tabs About, Content, and Legend. Under the About tab, we have the title of this map as well as the contributor. All of NM-CDC's contributors have been approved and vetted as to keep these data maps consistent and legitimate. If we click on More Details, it will take us to a page with more information about this map, such as when it was last updated. If we look to the upper right corner, we can navigate back to the map by clicking Open in Map Viewer. Now back at the map page, let's look under the Content tab. Here there are different layers of information. Based on which layer is selected, this is the information being presented. You can check the box to enable or disable its view on the map. There is also a section titled Legend. The legend will specify what the colors and icons mean on the map. For this instance, we have a color scale directly related to the color patches on the map, with blue being low and gradually going up to high, indicated by yellow. We call this a heat map. Based on how many incidents are in a specific area, the heat map is an average of these incidents. So generally, a blue area will mean low incidence or a single incident, while a yellow area will indicate a higher incident occurrence. You will notice that if you zoom into the map becomes more clear and the color zones more defined. If we click on any of these occurrences, we will be provided with detailed information on what time of day the incident occurrence was, severity, conditions, and even if death or injury occurred. The colored dots are indicators of alcohol licensing. If you click on one, it will give you more information on that specific license and who it is associated with. There are many different types of licensing involved, such as a dispenser, retailer, small brewer, wholesaler, etc. Again, the legend will aid you in identifying the dots and information they are conveying.
Those are the basics of navigating the site. For more information, be sure to check out our site and our other videos detailing other aspects of the portal. In our next video, we will go more in depth into navigation, as well as useful filter tools. Stay tuned.
All right, the next video that she mentioned, I'll go ahead and show that one. If I can get it to come up. Okay. All right. Well, it looks like we can't get the second video up, but I'm sure NMCDC won't mind sharing that second video, which I did have embedded into this presentation. And okay. All right. So going back to NM-IBIS again. This is as I showed you, the front-facing site does have an area where you can go to look at community reports. This is where we would go, and then we can select health region or county, or you can select the county, and then you can then look at specific health indicators. So right before we jump into our interactive portion of the training, we're going to take a 10-minute break. And maybe I can get my slide to work again. There we go. Did I say 10? Would it be okay if we took 5? If we need to take a 10, that's okay. But I was thinking if we did a 5, we could give you a little bit more time to peruse IBIS with assistance from some people from Department of Health. If I don't hear anything, I'll go with 5.
Chris, would be like in the recording would be available later on, right, to the participants?
Yes, absolutely. Everything you see here.
All the recording and the slides with all the links will be sent out in our newsletter and to all participants within the week.
Okay. And is there any PDF that kind of like shows like in a PDF form that shows some of like, you know, how like the same process, but like in a PDF format anywhere on the website?
So if you're talking specifically about IBIS, I think we have something, or we can create something like that. So with all the other resources we have, we would love to, we're planning on putting everything into, we have everything in one document to access data sources and then reports. And the things you've seen presented by NMCDC, I'm not really sure, but I'm sure we can make that available in a PDF as well.
Emily says there is a PDF. So if you can share the PDF, Emily, if you have the link to it, that would be great.
Oh, absolutely. Okay, let's take a 5-minute break, and if we could be back here at 2:15, we'll give you instructions on how the breakout room activity is going to go, and then we will go from there. Thank you all. Okay, welcome back, everyone. I hope you enjoyed your break off, even though it was brief. I'm going to turn it over to Annalise Mayette, who's also, as I mentioned earlier, a health equity epidemiologist that works with in the program I work in, and she's going to give instructions on how we're going to do this breakout.
Thanks, Chris. Can you progress the slides?
Yes.
Okay, so we're going to take, it says about 30 minutes. We might cut that to a little bit, just a tiny bit, to maybe like 25 minutes, but we still want to make sure that you have enough time to get in and being able to do some hands-on, because that's super important. right? We hear people talking about things and they show us stuff, and then you know, even if it's only a few days later or a week later, try to get in, and it's like so we're just going to do a quick activity. We'll navigate to the county reports in IBIS, go to your county. There's several different county reports there. So review at least one of those and identify one indicator in your county each that's maybe where your rates are worse than the state. So sometimes high rates are better, sometimes high rates are worse. And the report will show you that, and where it's better than the state or better than the US, because there's US in comparisons also on those reports. And also something that was unexpected or new. I know most of you know your data really, really well, but perhaps there's something that's just a little different than what you were expecting. I have dropped the link to IBIS into the chat so that you all have that. And just before our break, Chris walked through getting into those reports, but there'll be TA folks in each of the sessions or each of the breakouts who can help walk folks through, because we don't expect you to remember, you know, again, you need fingers on keyboards and do this yourself sometimes. So don't worry if you don't remember all the steps that Chris showed before the break. We'll go ahead and do that. And then also please know that we're going to ask people to share out after. This isn't the sort of activity that you're likely to have lots and lots to share out on. So we're going to try to do that share out fairly quickly. And I think that's it, other than thank you so much to Rebecca and Emily, who both put links for other links for IBIS that could be very helpful in the chat. And thanks for both of your support throughout all of this. But I think if there's no questions, all right, we're heading off to our breakouts.
So you should have a prompt on your screen. Just go ahead and click your region and you should be able to join that room.
Mine just says join a breakout room.
Yep, so if you click join, they should pop up with a list of the 4 regions.
Where's the join button at? I'm sorry.
Is it not just, it should be right on your screen. You can also start assigning people to rooms as well.
Because I got that message to click join, but I can't find join.
Okay.
It's coming up.
And you are in what county? Travis
County.
Okay, is anyone else having issues?
Yes, this is Evangeline Zamora. I don't have anything other than the participants that are on there. That's all I see on my screen.
Okay, and your grant, right?
Yes.
And mine says, please wait to be assigned.
Okay, and you are in?
Southeast region.
Okay.
Rebecca.
I don't have anything on mine. Nothing's showing.
And all mine says is wait to be assigned.
Okay. Let's start assigning people. Okay, who else needs some help? Anybody else? Althea, what county are you in? Or are you at Pueblo? Okay, I will go ahead and put you there. There you go.
Welcome back, everyone. Annalise, are you back as well?
Yes, our group
thank
is
you.
back.
All right.
Sorry, I haven't been turning my video on. So we just wanted to give people just a little bit of time quickly to share from their groups. I know that in the group I was in, we found that it was very slow. And so we had one person who was kind of able to get in and walked through for a couple of different counties. So sorry about that. Usually quite a few people can be on IBIS at the same time without that happening. But is there anything that any of the groups would like to share about their experience other than IBIS being kind of cranky and slow right now?
Annalise, this is Lori, and we had Brenda Bishop from the Quay County Health Council in the Southeast region in our breakout room, and she can share a few things about how that went with us.
I was able to pull it up pretty quick, and so I shared screen for Quay County, and we were going through and talking about what we thought some of the things were better and why we thought some of the things were worse. And we were looking at numbers, and so sometimes I was going like, these numbers are really big, differences, but it says they were similar. And so we were told that it was really nice to have the people in there who understood data. That's because statistically, us being so small, they had to have a really big range in order to make it different. So that was interesting. And the other thing that we went through all the different screens. We pushed on different buttons and tried different things, but we got to the heat map things, and we were noticing that there's like 3 heat maps. And so what does all that mean? And we learned about why and what the age adjusted heat maps mean. And we were able to look at different counties and the differences between crude data and age adjusted data and actual data. So that was interesting. And then we also learned about the information button and how to to pull that down and see what those data things mean. Because there was some things that we were like, well, what does this mean? And so one thing is in birth defects, we didn't know if that is based on where a child is born or where their residency is. And we didn't find that out yet, but it shows we have no birth defects. So we think it's where they were born. I guess that was our main insights.
Thank you. Did any of the other groups want to share anything?
I can share. I was in a room for the Southwest region, and Chris and Emily were leading our data discussion. And so I'm in Otero County, and I pulled up the county profile for my area. And like one thing that stood out at me, the first thing was that our teen birth rate was higher than New Mexico's rate and higher than the US rate. And then I clicked on the mental health specific indicators grouping, and one thing that showed that we were doing better was self admissions to the ER for crisis. And I thought, so just because there are fewer doesn't necessarily mean that's a positive indicator. It may mean that people are not accessing that service, not knowing about it. So we had a discussion about, what the numbers look like and what that may mean really on the ground in that community. And then Chris took us through the Doña Ana County profile, and there was a lot to see there. And we did some of the clicking on each individual indicator and what does that mean? Like, what was the specific question asked? And what does the trend graph look like? It was fun journey through data land.
Thanks, and that's a great point, that context matters. And having a lower rate doesn't necessarily mean, even though it shows that it's a lower and probably better rate than the state, it doesn't necessarily mean that when you get the context in there. Did either other group want to share, or are we good? Okay, I'm going to assume that we're good and pass it back to Chris. Thank you so much.
Yes. And yeah, thank you, Haley, for that comment. There are actually a lot of resources. We only have a couple of minutes left, and I wanted to talk a little bit about data interpretation. And I don't think I have enough time to go through all of it. I'll just talk about a few concepts here, and then I think the most important ones that some of the things we just looked at. But I would like to note that, let me see. Okay, there we go. That a lot of this stuff is available on IBIS. A lot of the definitions of these are, and if you were to just go in there and search, you should be able to find it. But then there is a tab that has resources, and you can go there and you can get more information on data interpretation. So some of the most important things to look at are counts, and counts is just simply a number of health events, such as deaths or incidents that occurred within a specific time period. Rates are quantities or degree of something measured compared to something else within something else. And so the degree or something that happens is what we call the numerator, and that the thing that we're measuring it in is called the denominator. And sorry for that short definition, but like I said, we'll make all these definitions available to you, and they're also available on IBIS. Age adjustment is where we adjust the rate that you're looking at for the age of the population that we're looking into, so that where we can remove the factor of age as a confounder or as an issue that is associated with whatever we're looking at. Standardized mortality ratio, it's the ratio of the number of deaths in the population over a given period. And that's all I'll say about that. And just I will remind everybody that that we're not expecting you to get all these concepts, but I just wanted to touch on some important ones. And like I said, you have more information. I'll skip over tests of proportions just for the moment, so that we have time to talk about confidence intervals, which you probably noticed as you were looking at your reports that it did give confidence intervals, and someone already noted that that if the range of the confidence interval was pretty large, that it was harder to say if you were worse or better than the state or the US as a whole. So when we're looking at confidence intervals, it's just basically a range of the probably true or probable true values of a statistic. And so if it's, let's say, for example, just say 10% of the population has diabetes, you have a confidence interval that goes from 8 to 12. So we know that if we say we're 95% certain, because a 95% confidence interval, we say we're 95% certain that the true value is somewhere between 8 and 12, which means that if we are comparing to another county where their rate is 11%, and their confidence interval interlaps with the county we're in, we can't really say that there's a difference there. And so you can use those to compare from year to year, not just from county to county, to see if there was a significant increase or drop in the rate. Then there's reliability and validity. Reliability is something that refers to statistical stability, or the degree in which we yield the degree in which multiple observations yield similar results. So we use those terms, reliability, sometimes you have precision and stability, to refer to the amount of random error that's likely included in an observed measure. And fortunately, you can still have confidence in the data that we put on IBIS, because we use statistical techniques to assess the stability of a given rate, and that's usually it usually can be found if you look at the confidence interval from, if we look at the estimate and the confidence interval from year to year. I must apologize for going through that fairly quickly, but like I said, we will make all the resources that we've shown here available. There's some other terms that I forgot to mention. Incidence, which is the number of new cases in a given time period. Prevalence is the proportion within the population, or the proportion of the population who have a specific characteristics in a given time period. Morbidity is another term for illness. Chronic diseases are an example, like diabetes. Not speaking of death, but diabetes, people who currently have diabetes in the population. And then mortality is just another term for death. And so when we're looking at mortality rates or mortality counts, that's just speaking specifically of death. There's some data challenges that are common, and one is, especially in small counties, there's no data to answer the question. So you follow the decision tree and you notice you don't have data for that specific topic or indicator that you're interested in. My recommendation is contact the data steward listed on IBIS. On almost all of those reports, you'll see a phone number or an email address. I would email that person. If that person can't get you to the right person to find the data, if that person can't get the data, they'll get you to the right person that can get the data for you if the data exists. And as was mentioned by Roberto earlier, we would love it if you would contact your regional health promotion specialists if you have questions or data that you can't find, or you know exists but it's not on IBIS and the Department of Health has it. Contact your regional health specialist. They'll reach out to myself and Annalise, and then we will then reach out to the epidemiologist or whomever within the Department of Health that has that data. The other thing is small numbers can be difficult to interpret. So if you need help with that, there are some tools on IBIS that do talk about small numbers. If you just go to the search and type in small numbers, it'll kind of give an explanation as to how to deal with it. Sometimes IBIS will make you aggregate, which means we'll just put more than 1 year there so that you have a larger number. Like some of the presentations that Annalise has done, we've combined 5 years of data so that you have an idea of where you are. But we're here to assist with all of these issues and data challenges that you might run into. And if you do go on IBIS, and if you notice that there is a link for a training that does give you an overview that you can do on your own time and self-paced on basic concepts and data analysis for community health assessment. That link doesn't work anymore, but this one is a similar training, and I'll talk to Raina, who runs IBIS, to switch that out. But nonetheless, I'll make this available to everyone to use, and you can do it on your own time. I went through it and I thought it was really well put together, really well done. A lot of the same things we got in this training, but like I said, you can do it on your own time, and you can look at the resources that they have available. A lot of these definitions that I gave are within there in that training. And I think it'll be really useful. And this is just the beginning. This is just the first training that I'm showing here, but there's other trainings available on that website as well. Okay, I'll stop sharing my screen. I want to thank everybody for coming. I know that we just ran out of time, but I do want to entertain questions and comments via email if you have them. I want to say a special thank you to CHI, NMCDC. Oh, I stopped sharing. Would you all mind putting your contact info in the chat, Emily? Because I didn't put it on the screen, but special thanks to CHI and Annalise, and special thanks to Haley and Jesse from Department of Health for helping us out today. I'm going to share myself and Annalise's contact info in the chat as well. And I don't know if Roberto is still on, if he has anything he wants to share to close us out.
I don't think he's on.
Okay. Thank you. All right, I'm gonna put, I know there's a lot in the chat, but if you want to hang on and get all that stuff out, you can. And then all these resources, I know it was a lot, but we're here to help sort it out for you. And I think there's a lot of folks at the Department of Health who would be willing to help. So just reach out if you do need help.
Yeah, I was just gonna say thank you guys. And I think, the key is, I saw some of the questions in the chat and some of the statements. It does get really hard and it gets really muddy in the rural areas. And I saw somebody commented that it was an inequity. And I can tell you, yes, it is. Having worked in the Southwest region, many of you have been up to Catron County, there's more elk than people, right? So yeah, it's really working with the experts like Chris and Annalise to get us at least those 5-year averages, right? So we can start to look and start to compare. So I would encourage you all to, don't be afraid to ask the question, articulate it best you can and reach out to your health promotion team. We can in turn, reach out to our friends in EPI, I say all the time, because I'm a public health guy. I'm a community health guy. I was never really a math major. So when you start getting into all these fancy terms, right, it's like way scary. So, but don't be afraid to ask is the point. So thank you, Chris. Thank you, Annalise. Thank you, everyone.
Thank you all for having us. And like I said, feel free to reach out and we'll do our best to ensure that everything we shared today, we should make that available. And I saw that it was recorded, so I'm sure that will be available as well. All right. Thank you all. Enjoy the rest of your day.
Everyone.
Bye. Be well, everyone.
Thank you.